Welcome to my channel once again, and we are going to continue from where we stopped in the previous presentation, which is under electrolyte imbalance. We were looking at hyponatremia the other time, so today we continue with the section 2 of that, which is hypernatremia. So hypernatremia, or high sodium level in blood. So this occurs when sodium is too high in blood. This happens when too much sodium is gained or too much water is lost in relative to sodium. So definition overview: when serum sodium is above 145 milliequivalent per liters is regarded as hypernatremia. So physiology: so when sodium is gained greater than water gain can lead to hypernatremia, or when sodium is more in blood as a result of water loss, that is hypernatremia. So let's look at the causes under sodium gain. So you have salt intoxication. So this is when excess salt is taken or sodium is taken. Then we have sodium bicarbonate, also has influence in the increase in sodium level in blood. Then we have hyperaldosteronism, which leads to the kidney retaining a lot of sodium. Then we have steroid use, which also increase sodium retention. So let's look at the causes under water loss. We have diarrhea and sweating. So water loss faster than sodium during diarrhea and sweating. You have diabetes insipidus, where there is polyuria, so there is frequent huge amounts of urination, which will lead to excess water loss while sodium is left behind. Then we have poor water intake, which will lead to dehydration whilst leading to increased osmolarity of the blood. Then we have high protein tube feeding, which increase water loss because of the byproduct, or the end product to say rather, the end product, which is urea, needs to be excreted by the kidney, which needs more water. So that will lead to more water loss than in relative to sodium that is left behind in blood, increasing blood osmolarity. So let's look at the signs and symptoms and why they happen. So the earliest sign you can note is intense thirst. So that's as a result of the body trying to correct dehydration while triggering hormones in the body to bring about thirst, so that the body can actually push itself forward to get water. Then we have dry mouth and tongue due to lack of water in the system. There's more sodium. Then we have flat skin and fever due to dehydration. We have low urine output because at this point in time a lot of water has been lost. So the kidney will try to conserve the little water available because already the osmolarity of blood is very high. So the reabsorption have to take place in order to go in there and then dilute the sodium level in blood. Then we have severe neurological signs that you need to note. This is when it has gone critical. We have restlessness and confusion due to brain cell shrinkage, since there is increased amount of solute in blood, meaning fluid are forced to move from the intracellular to intravascular compartment. We have hallucination due to altered brain function, seizures and possibly coma due to severe electrolyte imbalances. So let's look at some nursing care you can render to patients with this elevated level of sodium in blood. So you have educate on preventing sodium imbalance. So you have to educate the patients on sodium consumption, teach lithium uses sodium control. Lithium contained in some medication actually induce polyuria. They suppress certain hormones that allow reabsorption of water into blood to help regulate the blood osmolarity level. So patients on those medications are to be educated on how they take in sodium. Then you have to prevent dehydration by hydration. Then you monitor labs for sodium level in blood. With these mnemonics, you can actually remember what to do when caring for patients with hypernatremia. So we have to teach hydration, encourage the patient to take in oral fluids, educate lithium users on how to use sodium, avoid excess salt, then we check the labs, then we hydrate appropriately. Thank you. Thank you for your time. Until we meet next time again.